Bismillah ar-Rahman ar-Rahim. This lecture is about the health informatics as a discipline. The learning objectives are to state the definition and the origin of health informatics, identify the forces behind health informatics, describe the key players involved in health informatics, list the barriers to health information technology adoption, and describe educational and career opportunities in health informatics. So, why we need health informatics? The emergence of health informatics is partially due to the multiple challenges facing the practice of medicine today. For example, there is a growth in the amount of medical knowledge and patient information that has occurred due to a better understanding of human health, which has resulted in more treatment and interventions that produce more information. And that all of this knowledge and information, uh, one doctor cannot handle alone. Uh, Likewise, the increase in specialization, it has also created the need to share and coordinate patient information between these different specialization in a standard way to ensure the same meaning. Furthermore, the clinician need to be able to access the medical information efficiently and regardless of the location uh, or time of the day. And last, the technology has the potential to help with each of the previous areas, and with the advances of the internet, high-speed computers, voice recognition, wireless and mobile technology, healthcare professionals today, they have many and more tools available at their disposal. And but until now, there is a critical limitation of current information technology that manage data and not information. And there is a mismatch between what the clinician need. So the clinician need information, something to help managing meaningful data, which is information. And what they have is tools to gather and manage the data. So, health informatics can be defined as the field of information science concerned with management of healthcare data and information through the application of computers and other technologies. It began as a new field of study in the 1950s and 1960s, and it's more about applying information in the healthcare field than it is about technology. So here they are more concerned about the application of information than the technology. The technology here is used to generate, transport, and analyze useful healthcare data to arrive to information and uh, knowledge. So the ultimate goal of health informatics uh, is to use health information and knowledge to improve the individual health, the healthcare, the public health, and research. The large organizations, they have the necessary information technology tools and financial resources, leadership, and large patient population to be able to make evidence-based decisions in almost all uh, aspects of medicine. For example, they can improve the access to clinical information and support the clinical decision making to improve the individual health. And it has the potential to improve the medical measurement quality, the patient safety, the educational resources, and patient physician communications, and public health or public accountability, and decreasing the cost. And this is will improve the healthcare. And also it optimize the healthcare of population through best practice information management by developing applications and initiatives and programs to improve the public health. And last, they will create tools and resources to support the discovery and innovation and dissemination of research results. So health informatics is the broader term, and the subdomains of the health informatics encompasses bioinformatics as well as medical, dental, nursing, public health, pharmacy, medical imaging, and veterinary informatics. The health informatics toolkit are uh, first, there has been a movement to standardize the care of common and expensive conditions such as coronary artery disease, congestive heart failure, and diabetes. So the computerized clinical practice guidelines are one way to provide advice at the point of care. It provides a desirable diagnostic test or the optimal treatment regimen for a specific diagnosis. Generally, it will be based on the best available evidence. Then data must be shared among disparate partners, and uh, health information exchange or the sharing of information need to follow standard, or these data need to follow standard medical and clinical terminologies to allow the sharing of information. As technologies such as wireless and voice recognition become more commonplace and easier to use and less expensive, they will have and they will have a pressure on the practice of medicine. So computers and other technologies will be tools for the health informatics. And last tool is the information and communication systems. So build and operate a robust information environment that simultaneously enable the healthcare to foster learning and advance the sciences uh, and the best practice. The main components of health informatics, we have HIT, Health Information Technology, which is the application of computers and other technologies to collect, store, or communicate health data and information. فأي تطبيقات كمبيوتر أو تكنولوجي تقوم بجمع أو تخزين أو مشاركة المعلومات والبيانات الطبية تعتبر health information technology. Example, using devices to monitor the patient vital signs such as blood pressure and temperature, and store this information in electronic health records and uh, health information systems or hospital information system. The second component, we have health information management, HIM. Uh, the health information management traditionally focused on the paper medical record and coding, the medical coding, and with the advances of the electronic health record, the HIM specialists now they have to deal with a new set of issues such as privacy and legal implications of electronic data and electronic health records. So the HIM professionals, they plan and develop the policies and procedures used to manage the healthcare information in health information technology. For example, the electronic health record is a tool that health information management HIM professional will use to manage the patient health information. And the intersection between the health information technology which have the computers, which include the computer, software, networking, and health information management, which includes the coding, record, policy, procedure, privacy, and security, will give us the health informatics. Examples of health information technology, we have PubMed. PubMed is a web-based system for medical information retrieval. You can use the PubMed search engines to look for evidence-based and articles related to medical and health sub topics. We have here a simulation for education. So there is a simulation applications to teach and educate the student and the health professionals, e-prescribing and computerized uh, physician order entry اللي هي electronic prescribing الوصفات الإلكترونية للأدوية and computerized physician order entry اللي هو السيستم الخاص بإدخال أو طلب الأوردرز للفيزيشن مثل order lab test or radiology test, and the e-prescribing used to prescribe medication electronically. The mHealth or mobile health, this is mobile health applications that can be used on mobile devices such as iPhone and smartwatch. And there is the PACS, picture archiving and communication system, which is a system used for medical images storing and organizing. Telehealth, which is telehealth applications that provide health from distance. And we have here the hospital information system, which is a system that used to manage and organize hospital data and information. Google Health, this is a personal health record used by the individual to store his medical record and health data. Syndromic surveillance, this is a system that will monitor and detect the disease and the spread of medical conditions in the populations. So all of these are examples of health information technology. So we said that hospital information system, this is an example of health information technology. So to define it, it's the health information technology that is designed to manage all the hospital's medical, financial, administrative information in order to enable the health professional perform their jobs effectively and efficiently. So it's a system used to organize all the hospital data, medical, financial, or administrative. Example for the hospital information system is the best care 2.0 system. This is a hospital information system uh, used at the Ministry uh, uh, of Health, uh, the MNGHA, الشؤون الصحية. uh, uh, so uh, at King Abdulaziz Medical City, they use the Best Care 2.0 system as a hospital information system. Uh, it provides multiple functions, including electronic medical record, computerized physicians order entry (CPOE), nursing, radiology, special clinic examination, pharmacy, patient service, billing, inpatient services, and social services. Each module will provide its specific function applications like the patient's care, the order management, the scheduling, and various statistical data. Therefore, it's not only used by the medical staff, but also the hospital management staff will able to use various functions at the same time. And as a result, the hospital provides better quality of care and proper responses using advanced IT solutions. Another example of health information technology is Saha app from the Ministry of Health, the Saudi Ministry of Health. So it offers you a medical advice through certified and carefully selected doctors under the supervision of the Saudi Ministry of Health. You can consult your doctor through text, audio, or video conversations. You can also evaluate your experience after completing your medical consultation. So you can send video call, or you can make a video call, or you can send picture and audio or voice message to the doctor. There are multiple forces driving the adoption of health uh, informatics, but the major ones are the need to increase the efficiency of healthcare by improving the physician, nurse, and overall the healthcare productivity, um, improve the quality, the patient outcomes of the healthcare, which resulting in improved the patient safety, reduce the healthcare costs, and improve the healthcare access with technologies such as telemedicine, improve the communication and the coordination and continuity of care, improve the medical education for clinicians and patients, standardize the medical care, and the health information technology vendors to open a new market and create more disruptive innovation. In other words, as technologies such as wireless and voice recognition become more commonplace, easier to use, and less expensive, they will have an pressure on the practice of medicine. What is disruptive innovation? Disruptive innovation, they are innovations that just appear and soon take over the mainstream technologies by opening new market or turning expensive, difficult, or inaccessible products and services into simpler and more affordable or more accessible ones. For example, for potential disruptive innovations, the glucose sensing contact lens. Uh, these are a smart contact lens which aim to assist people with diabetes by constantly measuring the glucose levels in their tears. And here we have Uber Health, which is a web-based application or app, allows the hospital and other healthcare professional and organization to schedule rides to and from the patient home. When the ride is booked in advance, the patient will receive uh, a call or text with the scheduling information or appointment. When the car is on the way to the pickup location, the patient receives another call or text notifying them, and they will take them to the hospital or to the clinic and return them back to their home again. The key players who involved with um, health information technology. First, we have physicians and nurses. So the physician and nurses, they can do an online search with PubMed, uh, Google, and other search engines. They will look and search for online resources and digital libraries. They can use the patient web portals and secure email and electronic visits and telehome care to manage the patient care. Also, they can have a clinical decision support system which send reminders and alert, and electronic medication administration record, and barcoding medications and electronic health records, and smartphone loaded with medical software and remote access to the electronic health records, telemedicine and telehome care, voice recognition software, and electronic prescribing, disease registries, uh, picture archiving and communication system, and health information organization, e-research, electronic billing, and coding. And the patient, which is who are the second um, key player, they can do an online search for health information and research choice of physicians, hospital, or insurance company. They will have smartphone technology for text message reminder, health and fitness app, and internet access. They will have also web portals for storing their personal medical information, making appointment, checking lab results and electronic visit, drug refills, and online patient surveys, online chat and blogs and podcasts, podcast and support groups, personal health records, and limited access to electronic health record, and telemedicine and tele monitoring also. The hospital and healthcare organization also uh, are a key player in the uh, who are involved in the health information technology. So they can use electronic health records, electronic coding and billing, wireless technology, uh, e-intensive care unit or e-ICUs, e-prescribing patient and physician portals, telemedicine, picture archiving and communication system. And the fourth key players are the support staff. The support staff, they will be able to use the patient enrollment system and electronic appointment, the electronic coding and medical billing, electronic health records, uh, also tele-home care monitoring, and online educational resources, disease registries. And we have also the medical educators. The medical educators will be able to online search online for medical resources for clinician, patient, and staff. Use the PubMed search and telehealth using the video, teleconferencing, and podcast. And there is also the public health. The public health, they can use incident reports, syndromic surveillance as part of terrorism program and meaningful use program criteria. They can establish link to all public health department geographic information system to link the disease outbreak with geography, and telemedicine disease registries as part of electronic health record or health information exchange, and remote reporting using mobile technology. And there is also the health information technology vendors, or the companies that create health information technology. They will apply new technology innovations in the field of medicine, hardware, software, and genomics. They can use data mining to uh, analyze the data, and interoperability to share and exchange information, and certification to certify the technology and the tools used by the key players. The insurance company آه، هي شركات التأمين الصحي. The insurance company also, they are the payers. They pay for the patient, their customer. They pay the bills. They have electronic claims transmission, physician profiling. They have monitoring the adherence to clinical guidelines. Um, Alert to reduce the test duplication, and and they are member of the health information organizations. Uh, Also, we have the governments. The governments are another key player uh, for health information technology. Uh, they provide a financial support for health adoption and for health information exchange. They develop standards, services, and policies for health information technology, the disease management, electronic prescribing, telemedicine, the health information organizations, the health information technology workforce development. All of this are mission and done by the government for the health information technology. Medical research, medical research, this is uh, or these are the last key player involved in with health information technology. They provide online medical resources for clinician, patient, and staff, and provide online clinical CME, and also provide PubMed search and telehealth via the teleconferencing. Healthcare information technologies adoption uh, has multiple barriers in healthcare organizations. Um One, inadequate information. So We pointed earlier that clinicians need information, not data. And the current health information technology system, they are data rich but information poor. Second, inadequate expertise and workforce. So in order to adapt health information technology and implement, there is a need for um, uh, a need to a need for a large number of skilled health informaticians to create and install and capable of leading the implementation of electronic health records and other technologies. Uh, so the educational need to be expanded, the educational organization, uh, and a need to provide health informatics programs. Uh, and also, uh, there is a need to increase the health information technology workforce by training skilled workers and who have the knowledge of both information technology and clinical experience. High cost to adapt. So technologies such as picture archiving and communication systems and electronic health records are very expensive, and in addition to that, the support uh, uh, the support of this system another challenge or add more expenses, and there is uh, limited evidence that most technology will actually save money. The fourth point is the lack of interoperability between technologies. Without standard and interoperability between technology, the sharing of medical information will be uh, would not be the sharing of medical information will not happen and until the data standards are adapted and implemented in nationwide. The fifth barrier is the change in workflow. So there will be a significant changes in the workflow, which will be required to integrate technology into the inpatient and outpatient settings. Uh, and for example, the clinician may be uh, accustomed to ordering a lab or X-ray by giving handwriting request to a nurse who actually placed the order. Now they will or they need to learn to use the computerized physician order entry and the hospital information system to place their order. So with the most new technology, older users have more difficulty uh, to change their habits, even if it will eventually save time or money. Uh, and usually the main challenge is not technical. It's more about integrating the health information technology with the workflow and making it works for the patient and the clinician. 6, privacy concerns. So the Health Insurance Portability and Accountability Act uh, was created to ensure the privacy and security of personal health information that was largely paper-based, and with the advances of technology, uh, they are concerned now with covering the electronic transmission of personal health information. Um, this law or this legislation or act, they pressure the system and the healthcare organizations to enforce privacy and security uh, measures of personal health information, and there is now a need to protect these data. 7. The legal issues. So who owns the electronic data? So there is this major question has some legal issues because it's important for the hospital in order to share electronic health records and e-prescribing programs with clinician offices. Many new legal issues are likely to appear uh, regarding the ownership of the electronic data of the patient. The last barrier, behavioral change. So uh, the most challenging barrier is the behavior, because at least 50% of medical personnel will be slow to accept any information technology innovations, and it's important to realize that to make it possible for the medical personnel to accept the new technology or new innovations, it need to be uh, uh, they need to uh, provide a training or intensive training and before implementing the technology, and which will make it easier uh, to accept the new technology. The health informatics educational programs, most common degree is a master's level, but there is a PhD and associate, undergraduate, and certificate programs which are widely available now. And many programs, they are completely online, and some are online and traditional courses. Uh, the American Medical Informatics Association website, amia.org, hosts a majority of the available health informatics programs with a search engine and filters. You can take a look on the available health informatics program from this link. The Saudi Health Informatics educational programs. Here are two examples of health informatics educational program at Saudi Arabia, provided by King Saud bin Abdulaziz University for Health Sciences. The first program is in collaboration with the University of Illinois, UIC, Chicago, USA. They offers with King Salman Abdulaziz University for Health Sciences Master of Health Informatics program within the College of Public Health and Health Informatics here at King Salman Abdulaziz University for Health Sciences. Also, there is a Bachelor of Health Informatics, Health Information System, within the College of Public Health and Health Informatics at King Saud bin Abdulaziz University for Health Sciences. The main health informatics organizations, uh, the international organizations are American Medical Informatics Association, AMIA. It largely represents the physician and researchers involved with the biomedical sciences. They have about 20 working groups that focus of all aspects of health informatics. Uh, they host or it hosts a majority of the available health informatics programs with a search engine and filters, as we mentioned earlier. The second organization, Health Information and Management Systems Society, HIMSS. It provides multimedia educational materials and health information technology, and it maintains a health information technology body of knowledge resource site. The third health informatics organization is the American Health Information Management Association, AHIMA. They focus on health information coding, the health information management, privacy, and the analysis. Last, we have the Saudi Association for Health Informatics, SAHI. It is working under the umbrella of the Ministry of Higher Education within the supervision of the King Saud bin Abdulaziz University for Health Sciences, and it is dedicated to shape the future of healthcare in Saudi Arabia through the health informatics. Health informatics careers. The job posting have tripled since 2009, largely due to the widespread adoption of electronic health records and the necessary skill set for implementation, project management, workflow, redesign, training. In reality, most health information technology vendors and healthcare organizations, they are looking for individuals with good IT knowledge or information technology knowledge, clinical skills, and involved in IT projects. Example of job positions in health informatics, there is nurse informaticists and chief medical informatics officer and clinician informatician. Uh, Example, here we have the nurse informatics duties. So the nurse who can be an individual who work in the nursing department, IT department, or both will be can be a candidate for a nurse informatics position. Because most nurses, they are trained to think in terms of system and process improvement. They are extremely valuable for project management, um, IT system managers, and training. And Here we can see some of the nurse informatics duties. First, there is identifying and supporting computerization needs related to the patient care services, and training other nurses on changing record keeping protocol, uh, evaluate a healthcare facility to determine what clinical IT applications will help to increase the efficiency, optimizing the use and function of electronic medical records and patient care software applications, and ensuring that electronic documentation meets all the applicable standards of internal and external accreditation and review organizations.